So today we're going to be talking a bit about picking the right medical school. As Emily said, my name's Syra. I'm currently doing an F3 in Birmingham in the Major Trauma Centre here. So I'll talk a bit about some things to consider when you're applying to medical school, a little bit about the types of medical courses, and then how to make the most of virtual open days. So first of all, I just want to say a doctor is a doctor at the end of the day. And honestly, later on down the line, it doesn't matter as much where you graduate from. So it's important to prioritize the things that matter to you rather than looking at prestige and titles when you're applying to medical school, because yeah, once you become a doctor, no one really cares that much where you graduated from. So in the UK, we have 37 medical schools. You apply via UCAS and your deadline is in October, the year before you apply. So applications for this year have now closed. You submit a personal statement, and typically for undergraduate programs, you have 5 choices, but you can only use 4 of those to apply for medicine. So your 5th one either has to be something else or you have to leave it blank. So how do you choose? I remember this being a very difficult, it feels like a very stressful time when I remember doing it. And the way that my head of sixth form described it was it's a matchmaking process. So it's about looking at what do you have that you offer the medical school, and also what do you want from them. So what criteria are you looking for in them? What expectations do you have of your degree? Things like that. So what to look for in a medical school? One of the first things that might be important to you is the location. So depending on where you are now, you might want to be close to home, you might want to be far away, you might want to be in a big city, or you might want somewhere a bit smaller. So that's something to consider. Then looking at the course type. So there are 3 broad types of medical degrees. The first are your more traditional courses. So these are split into preclinical and clinical years. I think the main places that do these now are Oxford and Cambridge. They don't really exist beyond that. And you don't really get much clinical exposure in your first year. You go through all the science and the anatomy and things. And then your later years, you get more hospital placements and more exposure to patients. And then in your the other style that you have an integrated or a systems-based learning approach, and this is becoming much more common. So rather than studying your sciences separately, you can study one body system at once. So for example, the respiratory system, you'll discuss what the anatomy is, the different illnesses that you can get that affect the respiratory system, and it's all grouped into one nice package. And with systems like this, there's a lot more early patient contact. So some of you will be seeing patients from day 1 of medical school, or within the first year at least. And then you also have problem-based learning. So this is where you're given a medical case and you're split into smaller groups. It's more of an independent approach. So you have a facilitator that doesn't necessarily lead the session, but facilitates and observes what you're talking about and can guide a bit more. But that's something that also exists as well in a few of the medical schools. Another thing that you might want to think about is the type of interview. I understand that with everything that's going on with the pandemic, interviews will be running a bit differently this year. But on a broader spectrum, most places tend to have either multiple mini interviews, so your MMIs, or panel interviews. Your MMIs are where you have a few short stations. Typically you have different interviewers for each, and they will do different types. So you might have one that's about your commitment to medicine. You might have others that are a role play to see what your communication skills are like. So it allows for a much broader sort of assessment of what you're like as a person, as opposed to the traditional panel interviews where you might have 2 or 3 people that are sat there asking you questions based on your personal statement or about your commitment to medicine. And so you kind of get a chance with MMIs to reset and restart, which is quite nice. Another thing that you might want to think about if you're thinking about your 5th option, some biomedical degrees allow a small number of students to transfer into medicine at the end of the first year, depending on how you do, and you still have to go through an interview in most places as well. But it might be something to consider for your fifth option if you're wanting to include something. And finally, an intercalated BSc. So this is where you take a year out of your medical degree to do another degree, a Bachelor's of Science. And in some medical schools, this is compulsory. It's a part of the curriculum. Others you can do it as you choose. So if that's something that interests you, or there's a specific area within medicine that you're interested in, then that's also something to consider when looking at what the medical school course is like. And then the next thing to think about is, what do you offer? So most med schools on their websites will detail what they're looking for in their applicants. So it's important to have a look at what you have and what you offer. With regards to your GCSEs and A-levels, there'll be some places that want you to have, most places will have a specific set of grades that they want you to have at your A-levels, and some will want you to have taken specific subjects. So for some, they might be happy with biology or chemistry, others will want both. Others will look at the specific grades that you've got in some of your GCSE subjects, so English, maths, and whether you've done sciences at GCSE level. So look into those and make sure that you're meeting those requirements. The UCAT and the BMAT are another area that universities will have different requirements on. So some will look at one or the other, and within that, look at how they rank it. So for some places, the UCAT will be very important, and if you do really well, then it's great to apply there because you're more likely to get an interview. But obviously, at the same time, if you don't do as well as you'd like, then look at places that don't prioritise the UCAT as much. Similarly, with work experience, different places will expect you to have done different amounts of work experience. I imagine, once again, with the pandemic, they will be more lenient on what they're expecting you to have done, because getting work experience at the moment is very difficult. But the more important thing is how you reflect on it. But some places still do prefer candidates that have been able to demonstrate some form of work experience in a hospital or in a clinical environment. So if you have that, then great. But if you don't, look at what the universities are wanting. And personal statement. So different universities will use your personal statement in different ways. Some use it at the initial stage to decide who they're going to bring to interview and who they're not. Others don't take it in as much regard. So they might just use it if they've got a lot of candidates that are at a similar score number, say at the interview stage, and they're trying to differentiate between who to accept and who to offer and who they can't. So look at that and reflect on where you think your personal statement sits, whether it's something that you think is really good or whether you think there are other points in your application that are stronger. And finally, have a look at what the university itself is like. Medicine is more than the degree that you do, and looking at what your university has to offer in terms of clubs and societies, if there are things that you're specifically interested in, if you've got specific hobbies or sports clubs that you're a part of that you want to continue. It's important to look to make sure that those are offered at the university. But even if they're not, there's always a scope to start things. But think about life outside of medicine as well. So one thing to look at is the selection process. So when I applied, I got in an offer at Leicester, and that's where I studied. And the way that it was scored then is similar to how they do it now, which is on a points-based system. So you get a point score out of 64, 32 points are allocated to your UCAT score, and 32 are allocated to your GCSE score, your GCSE grades. So I remember when I applied, I worked out what my score would be, and I knew because I was scoring higher, I had a higher chance of getting an interview there. So I chose to apply there. So it's important to think about that process. Not everywhere is as open and as simple as this. Some places don't specify exactly where they rank things and how many points go to what. But looking into the detail of places that you are considering and thinking about where you fall within their criteria will be of great benefit. And then a little bit about open days. So this year things will be quite different during virtual open days. So I had a little look into how they're planning on running things, and most universities have a week where they'll be doing various talks and tours and things. Things that I would recommend doing is touring the campus, seeing what it's like. You kind of get a feel for the environment and whether it's something that looks nice and appeals to you. Small things like, do you want to be at a university that's campus based, or do you want a university that's in the middle of the city centre? Whether the medical school is part of the campus or not, and whether that matters to you, and maybe even things like where the accommodation is in relation to the medical school building, if you want to be someone that lives a bit closer, or whether you don't mind as much. Attend talks that are delivered by the medical school. So they'll talk a bit more in detail about the application process and the course design. And often they can give you little nuggets of information that you wouldn't necessarily get from reading the online materials and the online description. For example, I remember when I attended I think it was Newcastle Open Day, way back when, they talked about a program that they did where you shadowed a pregnant lady throughout her pregnancy and the early stages of the baby's life as part of your second year. And it gave her a really useful talking point when I had my interview, because I could talk about something that was unique, that wasn't written anywhere on the website, and it showed that I'd taken initiative and was interested in what the medical school had to offer. Also attend the question and answer sessions that they run. So this will be with a mixture of the college professors as well as the students that are there, and use the opportunity to ask the questions. They don't just have to be about the medical course. It's a great chance to speak to students about the societies that are run at the medical school and at the university, what the halls are like. You might be interested in getting a part-time job, so finding out a bit more about that. And I think it's really useful to ask a student that's there what they like the most, because it reflects on what matters to them in the medical school. It might be something that you completely agree with and you think, oh, really nice to hear that that's how the medical school is, that's really important to me. Or it might be something that you completely disagree with, and it gives you a better reflection of what it's like, especially when you don't necessarily have the opportunity to go and see in person and be there in person. And yeah, that's about it. I'll pop this link in the chat. It's a website where they've gone through all the different medical schools, and they've summarised how their requirements are for this year in terms of work experience, personal statement, grades. So it's really useful, and it might help guide you guys a bit more. But now we can open up to any questions if anyone's got any. Feel free to either unmute yourself or just comment in the chat.
Hi, I was just wondering what medical school you went to. I didn't really catch it, and which ones you applied for.
So I went to Leicester. So I applied. I started medicine in 2013, just to give you a bit of a time frame, so in case anything that I'm saying is a bit outdated. But yeah, I applied to Leicester, I applied to Newcastle, I applied to Sheffield, and I applied to Imperial. And then Leicester was the only offer that I got, so that's where I went. And actually, I think the majority of people that I know mostly only get one offer for medical school, so that's not a bad thing, and that's not uncommon at all.
Okay, thank you. And I was just wondering, how did you choose those medical schools? Like, for each one, what made it stand out to you?
So for Leicester, I had a family friend who was a couple of years older than me who was studying there, and she was very positive about the experience. She'd really enjoyed her time at Leicester. When I came for the open day, she was the one that showed me around, and I think for me that was a big influence as to why I applied to Leicester. For the other places, I wanted to give London a try, which is why I went for Imperial. I spent a lot of time deliberating between Imperial and King's, and in the end I just wanted to give the BMAT a try, so I went for it. That was my my more risky choice. Newcastle, it was similar. So I grew up, my family lived in the northwest, so I wanted somewhere that was a little bit closer to home. So I applied to Newcastle because it was a bit closer than everywhere else I was looking at. And similarly, I liked the vibe that I got from the open day. It was more of an integrated systems course, which mattered to me. I wasn't that keen on PBL, and I wasn't that keen on a more traditional course. I wanted something more integrated. And Sheffield, I don't really remember why I applied to Sheffield. Yeah, I think it was just a different one of the other ones that I applied to, but I don't really think I had a reason for it.
Okay, thank you so much.
That's all right. So, what else have we got?
So on the chat, there's a question asking, what is PBL like?
So my understanding of PBL was that sort of how I described it, you're given a case and you use that as your starting point, and within a group you discuss the case and you go away and you do further reading to understand more. So if you're looking at an illness, you might go away and read about the anatomy and the normal physiology of that system, and then also read it into how the illness affects the system, how it can be treated and managed, and so on. That was my broad understanding of it, but I didn't do a PBL course, so I don't have much more to add, unless anyone else.
I mean, because I didn't go to PBL either because I was Leicester, but it's worth looking at each individual university and seeing what their PBL is like, because it varies between them. So some universities are very heavy PBL in that it's very, very much focused on your group work, going through the cases, as Sarah just said. But some of them they describe themselves as PBL, but actually they have a fair number of lectures alongside that. So have a look into each individual universities because they are slightly different.
And if you don't mind me asking, how did you choose between, you said you preferred, I think Sarah said she preferred integrated as opposed to PBL or traditional. Why was that? What made integrated stand out more than the other two, or why did you not like the other two?
So for me, I like the idea of having early clinical contact, which is why I wasn't that keen on a more traditional course. And in terms of integrated, I'm someone that thrives better when I've got more support and direction, and I didn't think a more independent approach where I had to guide my own learning would suit me, just because I'm someone that likes to have a list of the topics that I need to know and how to structure my revision, and I was worried that I wouldn't necessarily have as much structure in a PBL course, but there are some people that it suits better. So it's worth, like Emily said, looking into how each university delivers their course, and I guess thinking about how you learn and how you study and what matches best with that.
Okay, thank you.
That's all right. So Madhav has asked, how do you show any unique experiences in an interview? So this is where I guess you have to be a bit more creative. It depends on the style of interview. So for us at Leicester, we had MMIs and we didn't really get much of, I think we had one of our 7 stations where you spoke about what you'd done, and you had an opportunity to use all the years of experience and extracurriculars that you'd done in a 5-10 minute station. I guess it's thinking about the common questions that they can ask. So talking about leadership opportunities, team working skills, and having a specific example that relates to those. So if you're thinking about your unique experiences, thinking about what you've gained from those experiences and what they will offer, how they'll help you be a better doctor, is probably the best approach. And then from there, you can almost do the reverse when you get asked questions at interview, if you thought about how those experiences relate to the questions that they might ask, if that makes sense. So next question, how do you compare courses in terms of content between universities? So the thing is with most medical schools, there's a general curriculum that the GMC set out. So most things will be covered by all medical schools. There's very little variation in terms of the content that they deliver. It's more the structure that varies. So when you get your clinical experience, how they structure, whether it's lectures, whether it's group work, whether there's a mixture, that's what you can kind of compare between the universities. Like I said, at the end of the day, you're going to be a doctor, so there's a certain amount of content that everywhere has to cover, and that doesn't vary as much. What work experience did you do? So I was quite fortunate in that my dad is a doctor, so I managed to get more work experience than maybe some of my peers did, just because of the contacts I had. So I did a week in a GP surgery when I was in year 10. I did a few weeks when I went to Pakistan one summer before starting my A-levels, and then I did another week in a hospital in year 12, and then I also been volunteering in a nursing home. But honestly, quantity doesn't matter. And when I wrote my personal statement, I think I was only able to reflect on some of the work experience that I'd done, and I used it more as an opportunity to talk about what I'd gained than listing everything, because you don't have enough characters to go into depth about what you do. And I've seen people that haven't done much, but have even used examples from outside healthcare, from working in a shop at the hospital, to talk about the skills that they've gained and how it's going to make them a good doctor. So that's probably more important.
Just to contrast that, because I struggled to get work experience when I was applying. So I had a week at a community hospital and then 2 days at a larger hospital a few years after that. And then I did some work at a youth club throughout that time. So that was less than what I think a lot of other people had, or sounded like they had, when I was applying. But actually, I still managed to get a personal statement out of it. I still managed to reflect on it, as Sarah said. So don't worry if you haven't got weeks and weeks of work experience, especially at the moment.
So next question, have you done an intercalated year, and if so, would you recommend it? So I actually didn't intercalate. Went straight through, mostly because at the time that intercalation came up for me, there wasn't anything that I was that interested in. But Emily has done a BSc, so she might be able to comment a bit more on that.
Yeah, so I intercalated by essentially joining the last year of a biological sciences course. So I did more of a kind of lecture and essay based year. So I selected the kind of the modules that I was interested in. So at the time I was quite interested in neuroscience. So I did a lot of like kind of neuroscience in insects versus humans, and sort of the neurological functions of the brain, those kind of modules, which I really enjoyed. I think at the time it was nice to have a bit of a break from medicine, and at the end of it I was like, I've enjoyed this year, but medicine is definitely what I want to do. So it was helpful to kind of have a little bit of a break, but it kind of reaffirmed that wasn't what I was interested in so much. I mean, obviously it's so I did join the last year of a biological sciences course, but a lot of universities, and Leicester did this as well, you could do like a research project. So I had friends who did research projects instead, and some of those were based in clinical settings. So it was based on patients and some project about a clinical question, and some people did them based in labs. So I had a friend who did lab work, essentially looking at neurons in mice. So there's a huge range of projects out there, and some people went to other universities. So I would definitely recommend having a think about it, because it's good to have a bit of variety. It does give you a chance to try something a little bit different. There are a lot of opportunities for research alongside medicine. and doing academic work or like teaching work or other aspects other than just doing the day-to-day role of a doctor. So it gives you a chance to kind of try those things a little bit earlier on and see if it's something you enjoy. Obviously it is something to go on your CV and your applications, but having said that, it's not you must do it or you're going to be horribly disadvantaged if you don't do an intercalated year, because there are plenty of people who don't and they just want to go straight through, and that's absolutely fine.
What is the integrated teaching style like? So once again, this varies from medical school to medical school, and actually within integrated, there's so much variety between what the medical schools offer that it's useful to read through how they describe their course and how they structure it. For us in Leicester, we had a systems-based approach. So our first semester was more sort of basic sciences, and then from second semester onwards, we did each individual system, and we covered like the anatomy, the physiology, and then we covered the diseases. So I liked that setup. I felt like it was easier to understand and remember things rather than studying the anatomy at one point and then having to go back to it when you covered the illness. So that worked for me, but yeah, there's a huge variety. So the best thing would be to read about how each medical school offers it and see what appeals to you. Would all the good medical schools be Russell Group University? I'm not sure that they necessarily are, but it's once again, it's not something that matters so much necessarily in terms of how you're looked upon after you graduate. At the end, when it seems like a big decision now, and it really is a big decision when you're applying. But once you get through medicine, at later stages when you're applying for training jobs, and even I was speaking to a consultant today who kind of said that actually in hindsight no one really cares. It's just having the degree that matters. So whether or not it's a Russell Group, I don't really know, because it's never really mattered. So next question, would you say it was helpful to have early patient contact? What were the benefits of this for you? So for us at Leicester, we had a system where in our first year we kind of got given a patient who had a long-term condition, and we would regularly go visit them every few weeks, probably every few months we go visit. And in our second year, we took everything that we gained from them about their experience with a long-term condition, and we wrote a dissertation. I quite liked it because it was a chance to get to practice the basic sort of history taking skills that you'd learnt through our communication sessions and build on that. And then as we went into our second year, we did more patient contact stuff. And then by the time we went into our third year, we properly started our clinical placements. We had a basic understanding of how the hospital ran. We had, mastered or semi-mastered the basics of taking a history and speaking to a patient. So I quite liked having a gradual build-up rather than going from all lectures to all clinical at once. But everywhere introduces it differently, and I know even Leicester's changed from how they did it for us compared to how they do it now. So a few years back, I think they were bringing first year students into med school within a couple of weeks of starting. So I guess it's what suits you. But personally, I think early contact is good, and it allows for you to gain confidence and familiarity with communicating with patients. Do the type of exams differ across different medical schools? They do, and this isn't necessarily a good thing or a bad thing, but there is variation. I don't know specifics in terms of how often they examine, whether it's more written papers or multiple choice. Generally, there is a trend towards doing more multiple choice papers nowadays, because that's how postgraduate exams are for us. And I know there has been talk of having a standardised finals exam, which is just going to be a multiple choice. I don't think they've introduced it yet, but that's something that might be there by the time you guys get there. So there is variation, but I don't know how specific universities tackle exams. But it might be something worth asking at open days and asking students how they find their examinations and the systems. What questions could you ask to the interviewer? I guess any questions that you have. I don't think I remember asking any questions, more because of nerves on the day, but it depends. In an MMI setting, you might not necessarily have much time because your stations are so quick that you don't really get a chance to speak to your interviewer. In fact, if you finish all the questions that they have to ask you, it's a blessing. But in your panel interviews, you might get an opportunity. I would say if there's specific questions you have about the course, then you might want to ask then. But I also think it's okay to not necessarily have questions prepared, because you're better off not asking than asking something that's might feel silly or inappropriate. Does Leicester offer full body dissection? Leicester did offer dissection when we were there. I think it still exists as far as I'm aware. And then what are pros for Prosection? So I think once again this is something that it varies. So there aren't many places in the UK now that do full body dissection. I think there's maybe 5 or 6 of the medical schools that do, and it's actually prosections can be quite good if they've been prepared really well. Then you can see the anatomy and visualize it. If you know that you want to be a surgeon and you're particularly interested in it and definitely want to get involved with dissection, then that might be something to prioritize. But at the end of the day, I think the experience is quite different compared to when you're actually operating in theatre. And I didn't really enjoy dissection when I did it in my first year, and now I'm leaning towards a surgical career. So it's not necessarily that important, because you still will learn your anatomy. Would you say doing your medical training at Leicester has made it more likely, made you more comfortable doing your foundation years in Leicester as opposed to somewhere completely different? So for me, I stayed in Leicester for my foundation years, and I think yes, it did. By staying in Leicester, I mean, for like our final year, we had an assistantship programme where we shadowed the F1s that were already working in Leicester. So when I started, it meant that I knew how the systems worked. So small things like I knew how the exact equipment for taking bloods, I knew where to find it. I knew how to do a discharge letter and request an X-ray, and really basic things that you don't necessarily think about until you start somewhere new. So for me, I found it really helpful, because it allowed me to concentrate on the actual job rather than worrying about where things were. But actually a lot of people move around, and I've now left the East Midlands and moved to the West Midlands further down my training. So it doesn't necessarily tie you to that place. But for me, I found that it did. It did make it easier to stay in Leicester, just knowing the systems and feeling a lot more comfortable.
If you do move, because I moved for my foundation training, just because I wanted to do a academic foundation with education, which Leicester didn't offer at the time. So I ended up moving, and I think if I hadn't wanted to do that, I would have probably stayed in Leicester. For the reasons that Sarah said, but actually moving, obviously it is a bit of a shock. You do start a new hospital with no idea where anything is or how to do any of the basic things like write a discharge summary or how to find any of the referral systems, but you pick it up really quickly. So it's not an absolute thing that you'll be lost if you move.
And you're almost guaranteed to have F1s there who have studied there. Some of them may know the system, some of them may not, but you get a mixture in most places. So Maddie's asked, what are you and Emily thinking of specialising in the future? Do you have any ideas? So I'm wanting to do surgical training with the end goal of doing trauma and orthopaedics. So that's what I'm aspiring to at the moment.
And I want to do anaesthetics.
Cool. Are there any other questions at all, or anything else that anyone wants clarifying?
Do you mind if I ask, I think, Emily, about the AFP? Is that what you're doing?
The academic?
Yeah.
Yeah, so essentially, normally in your foundation program you have 6 rotations. And for me, one of my rotations is based between the university and the hospital, and is associated with the medical school. So it's kind of looking at getting involved in their course structure, some of their teaching, and preparing like teaching materials for them, and then any other kind of like teaching projects that they have going.
Is that the academic foundation program?
Yes. Yeah.
Oh, okay. I was going to ask, if you weren't thinking of doing an AFP, but would you say that disadvantaged you in the future if you wanted to apply for something like the ACF?
No, no. So basically, at each level of training, there is kind of like an academic version, and it doesn't disadvantage you not having done like the step before. And what they're looking at are people who have experience and have the drive to do it, and you can show your experience in other ways. So if, for example, on the education side, there's so much opportunity to get involved in just ad hoc teaching on the wards. If you've got medical students, then just doing like little teaching sessions with them alongside your ward work, that's all experience. And there's always like revision programs, like kind of teaching help sessions that universities are organizing. So if you don't do an AFP, there's plenty of other opportunities to get involved in teaching. With the research ones, obviously that's slightly more difficult, but again, there's loads of projects going on every day in hospitals which are related to research and related to sort of audits and quality improvement projects, and all of those show the same kind of skills that you can then talk about when you apply for the academic versions later on. So it's not you don't need to have done it now.
Okay, yeah. And would you say Leicester, I know the AFP is quite competitive to apply for, would you say Leicester kind of helped you get to apply, or?
So I think they did talk about it, and they did have sessions about the AFP versus the foundation program, and certainly for those who wanted to do research, there was like a journal club which was really good at kind of developing skills at how to read a academic writing and how to interpret results and discuss it and discuss the weaknesses and positives of a study. So that was really helpful for people who wanted to do research-based studies. So I think Leicester were pretty good at kind of introducing the idea and giving you help if that was something you're interested in.
Okay, yeah. And if you just one more question, if you don't mind. When you decided to apply for the AFP, is that kind of because you might look at doing kind of research in the future, and that's something you're interested in, or what kind of made you want to apply for the AFP?
So I was quite interested in teaching, and I'd been involved in various things throughout my time at uni, and I kind of thought the foundation program would be a good chance to do it in a more formal capacity, because throughout your whole career you can get involved in, as I say, there's loads of opportunities for teaching just as and when the opportunities come up, or you can go into a more formal route where you kind of take up like a teaching position at a university, or running programs specifically in conjunction with the university. And I guess what I kind of thought was it'd be a good opportunity to try it in a more formal capacity and see if that was something that I wanted to do, as opposed to just being involved with it on the ward and in the hospitals. So I thought it would be a good opportunity to do that in say it's 4 months out of my foundation training, it doesn't tie me down for longer than that if I decide it's not for me.
Yeah. And would you say it disadvantages you not having that kind of the extra rotation in the hospital since it's foundation years and we're kind of getting used to it?
I don't think it does. You obviously you do lose a rotation of clinical work, which if you're trying to try out all the different as many different specialties in medicine that you can, obviously it does take one of your opportunities away. But actually, as a F1 and an F2, your job on medicine and surgery really is very, very similar regardless of your specialty, because you're kind of doing all the basic ward work, and like absolutely you do pick up stuff about that specialty and more kind of specialized knowledge, but the basics that you have to be good at is the same regardless of your rotation. So actually I don't think it disadvantages you by losing a clinical rotation, and it does give you other skills. The one thing to say is that some places do it as an ongoing thing. So throughout your F2 year, you have some days a week allocated to your academic rotation instead of just doing it as a 4-month block. And that obviously gives you a bit long, well, it's the same amount of time, but it's over a longer period. So that might work better for some projects because it gives you a bit longer to kind of set them up and do the investigations and get the results. But speaking to some people who've done that, they did find that slightly more disruptive because they'd be on like their normal ward work for some of the week and then they'd be away and then they'd come back. So it's something to think about as to whether or not that sounds like something you'd like, because it does mix it up a little bit more.
Okay, thank you so much.
Okay.
So we've had a few more questions. Is it true that when applying to medical school, you have to pick one non-medical related uni? How do you choose that different course at a different uni? So when you're applying, so you have a maximum of 5 choices on your UCAS for an undergraduate degree, but only 4 of those can be medicine. So with the 5th option, you can apply for something different, or you can leave it blank. Most people I know did something like biomedical sciences if they applied for a 5th. Some of them were applying for the specific biomed courses that allow you to transfer or give you the potential option of a transfer at the end of your first year. But otherwise, a lot of people did still leave it blank. The only thing that I would say is to bear in mind that your personal statement should reflect both specialties or both subjects that you're applying to. So it's quite difficult to pick something completely different to medicine and submit the same personal statement. Yeah, but whether or not you use that choice is up to you entirely. And actually, because the deadline for the rest of UCAS is later on in January, and actually most biomed courses or most medical schools will sometimes say to you that, oh, we haven't offered you a place. If you're interested, you can apply for our biomed. So some places do that as well. So it's not necessary that you have to make that decision before you submit your application for medicine. You can add that in later on if it's something that you want to do, or you can leave it blank. When do Leicester give out their interview offers? Does Leicester have a UCAS cut-off score? So in our year, Leicester's were more staggered, if I remember. They did 3 rounds of interviews. It was end of December, end of Jan, end of Feb, and they staggered out when they gave. I think most people had heard in December whether or not they were getting an interview, but as to when you heard back, it varied a lot. Some people heard sooner, some people heard later. So it varies, and I imagine things will be different this year because the structure for the interviews will be different. So I don't know when that will be this year. In terms of the UCAT cut-off score, they don't as such have a cut-off score, but if you look on their website, they've got a table which shows the conversion of points. So you get a maximum of 32 points for your UCAT score, and it shows you what UCAT score equates to what number out of 32. do you know which biomed courses allow you to transfer, or which unis? I think there's 6 or 7. Leicester was one, I think Newcastle was another. I can't remember any of the others off the top of my head. Yeah, I can't remember the rest, but I know those were 2. All right, I think that's it. Oh. What kind of balance did you have in your personal statement in terms of talking about yourself and why you chose medicine, or asking about your work experience? So everyone will structure a personal statement differently because it's personal to you. When I applied, I remember my head of sixth form telling me to focus about 3/4 of my personal statement on medicine, and then I had 1/4, so 1 paragraph on all the other extracurricular things I'd done, like instruments and hobbies and other things outside of medicine. In terms of talking about work experience, like I said before, it's talking about how it's relevant to why you're interested in medicine, and also talking about what you gain from the work experience. So I think I had my first paragraph, I spoke about work experience, because when I did my 3 weeks in Pakistan, I got to see some open heart surgery, which is quite interesting. So I started off my personal statement talking about that because I thought it would grab attention. And then I talked about the skills that I'd seen, the differences in the healthcare between Pakistan and here, from the work experience I'd seen here. And yeah, I had that paragraph on that. But I think it depends on what you've got to talk about. So when I did my first draft, I just wrote down everything I had to say, and it was well over the character limit. And then I went back, I refined it, get other people to read it and to give you advice on what they think works, what doesn't. But it's really, I guess, it's making it sound, so specifically with work experience, it's relating it back to why you want to be a doctor and what it showed you about how to be a good doctor, rather than just listing everything that you've done. And then just how long you attend med school will depend on your course / uni. It does a little bit. So most places, it's a 5-year degree with an optional BSc, an intercalated BSc here, and but there are a few places where it's compulsory. So Oxbridge, I think everyone does a BSc, and maybe a couple of the London unis as well where it's compulsory. So yeah, it does vary, but it's quite clear on the university's website how long their degree is and whether or not that's compulsory. And yeah, I think that's it for the questions, unless anyone else has anything else to add.
Well, I just had a very good question. Sorry, I was wondering how much influence so each med school is linked to some hospitals. I was wondering how much influence kind of the hospitals that your chosen med school is linked to has. So like the ones that you're going to be like working in, not working, but experiencing stuff in clinical years, and whether you think that should influence your decision, or whether that's not really that important, because obviously you don't know which rotations you're guaranteed in which hospitals. So
yeah, so I think if you have areas where you're specifically interested, so some specialties, things like neurosurgery and plastics, you don't routinely have at every hospital. So potentially considering hospitals in bigger cities where those departments exist might be more important. But actually most medical schools aren't linked to just the one hospital, they're linked to a number of hospitals. So when you go on your placements, you'll have a mixture of hospitals that you go to. So for us in Leicester, we had Northampton, we had Kettering, Burton, Lincoln, there are probably more that I've forgotten about. Boston was there as well. So there's a larger catchment area of hospitals that they send you to get you the experience of what it's like working in a teaching hospital in a city centre. and also what it's like working in a district general hospital. So it's something to consider if it's important to you, but at the end of the day, I don't think it makes a big difference, especially not later on down the line in terms of how it affects your career.
Thank you.
It's all right.
I'm just going to put in the link to the feedback form into the chat. If you guys could fill it in, we'd be very appreciative.
I'll also share the link to the website that I mentioned, and it's got quite a nice summary of the different requirements for the medical schools for applying for this year. So they may change next year, but this is a summary of the requirements this year. And that's it. Thank you all very much for joining us, and please do fill in the feedback form for us. It helps us to improve our sessions, and it gives us a chance to find out what we're doing well and what we can improve on. And yeah, all the best.